Hi everyone. I would like to talk to you all about MMR and what the MMR vaccine is. Well, first, let's start off. What it does MMR stand for? MMR stands for measles, mumps, and rubella. Measles is a very contagious respiratory virus that has a high mode of transmission. What does that mean? A high mode of transmission means it is very, very contagious and is easily spread from one person to another person. The virus can be spread through coughing, sneezing, or just by breathing in the same air as an infected person. Now, I know what you're saying. Those symptoms sound just like influenza symptoms, which that is true. So it is very important that whenever somebody thinks they have come in contact with measles, that they self-isolate and they manage their symptoms to make sure that they don't turn into anything more complicated or anything more severe. Another symptom of measles is conjunctivitis or red and watery eyes. And a complication that can happen due to measles, if left untreated, is pneumonia, brain swelling, or even potentially death. Mumps. Mumps is also a very contagious viral infection that is a part of MMR. Mumps causes very painful swellings of the salivary glands, which is located in your throat and in your mouth. If those glands become swollen, they can impair a person's airway and breathing. So it's very important, and it is a very serious infection. Symptoms of mumps include fever, headache, and muscle aches. A differential factor of mumps is the enlarged salivary gland. So that's how you would know if you came in contact with mumps or if you were infected with mumps. Sorry. The infection can spread by coming in contact with respiratory droplets or saliva. How you come in contact with a respiratory droplet is by somebody sneezing, coughing, or talking to you in their expectorate and spit. Rubella. Rubella is also known as the 3-day measles and is another very contagious viral infection. Rubella poses a significant risk to pregnant women due to its ability to cause birth defects to the unborn child. According to the CDC, all three diseases present with flu-like symptoms such as fever, sore throat, and headache. So it is very important to monitor your symptoms if you think you have come in contact with any of these infectious diseases. The MMR vaccine is usually given in 2 doses. Children usually receive their first shot of the vaccine between the ages of 12 and 15 months. And they usually receive their second dose of the vaccine around the time they start kindergarten between the ages of 4 and 6 years old. Although those diseases are more prevalent in children, they can affect anybody of any age. So it's very important to get vaccinated. Health officials recommend the MMR vaccine because it protects individuals against the disease and it protects other individuals who might be immunocompromised or just cannot receive the vaccine quite yet due to their age. For example, infants, they might not be able to, they're not able to receive the vaccine due to their age and their developmental stages. So it's very important for other people to get vaccinated and so that the infants do not come in contact with these diseases, because it could cause very severe complications for those infants or those unvaccinated people. Side effects of the MMR vaccine, include arm soreness at the site of injection, a potential low-grade fever, a mild rash, and temporary jointness or stiffness. All of these side effects, they're not guaranteed to happen. However, they can happen. They're potential side effects, and so it's just important to monitor somebody after they receive their MMR vaccine to make sure their side effects don't progress into anything worse. It is very important to get the MMR vaccine because it protects the whole community and it allows individuals to stay safe, especially children, as they enter these highly filled areas with other children. So that's why we often see measles outbreaks within children, because children are in areas with high areas of other people, and they're usually the ones who are at that age supposed to receive the vaccines. So that's why we see them more of these issues in those age groups. But yes, thank you guys for watching my video about the MMR vaccine, and I hope you all have gained some knowledgeable information.